Hi all, welcome to Physio Exam Buddy. This video is on the cardiac cycle, that is the mechanical events happening in the cardiac cycle. What is the definition for cardiac cycle? It includes the electrical as well as the mechanical events occurring in the heart from the beginning of one heartbeat to the beginning of the next. And the total duration of the cardiac cycle, it is 0.8 second when the heart rate is 75 per minute. And whenever the heart rate increases, the duration of both our systole as well as the diastole decreases, but diastole is shortened to a much greater degree than the systole. So first we will study about the duration of the different phases in the cardiac cycle. The cardiac cycle includes atrial systole as well as the atrial diastole as well as the ventricular systole and ventricular diastole. And we have seen that the duration of the cardiac cycle is 0.8 second. So here each squares, it represents the 0.1 second. So this topmost portion is the atrial component, that is the atrial systole as well as the atrial diastole. So one square is 0.1 second. So this is the location of the atrial systole, and rest is the atrial diastole, which constitute around 0.7 seconds. And the bottommost portion, it is the ventricular component. So the cardiac cycle is basically divided into ventricular systole as well as ventricular diastole, and the ventricular systole occupies this portion, that is the ventricular systole will start simultaneously along with the atrial diastole and it extends for 0.3 seconds, whereas the ventricular diastole as shown by this VD, it extends for 0.5 seconds, that is here 0.1, 0.2, 0.3, 0.4 as well as 0.5, but this last portion of the ventricular diastole, it actually coincides with the atrial systole. So now we are going to see the events happening in the cardiac cycle. So I have already told the definition of the cardiac cycle, that is it includes the electrical as well as the mechanical events occurring in the heart, that is from the beginning of one heartbeat to the beginning of the next. So these events in the cardiac cycle include electrical as well as mechanical events. And electrical events here, each cardiac cycle is initiated by spontaneous generation of action potential in the sinus node, which is then conducted through the atria, AV node as well as bundle of his into the ventricles. Okay, and this depolarization or repolarization of the atria and ventricles can be recorded extracellularly using our ECG. Next is about the mechanical events. This video mainly deals with the mechanical events, that is the contraction as well as the relaxation of the atria and ventricles following the electrical events causes. Mainly these changes are expected in the cardiac cycle, that is pressure changes which happens in the atria, ventricles as well as in the great vessels, and also volume changes and certain heart sounds will also be seen in the mechanical event. So whenever a question on cardiac cycle is asked, you are supposed to draw this diagram, that is the Wiggers diagram. This is mainly based on that the American physiologist named Wigger in 1920, he carried out some of the fundamental studies in the cardiac cycle. So each cardiac cycle, we know that it is considered to be consist of simultaneously occurring of the atrial cycle as well as the ventricular cycles. So atrial systole as well as atrial diastole, atrial systole occupying only 0.1 second, whereas the atrial diastole the remaining 0.7 second of the atrial cycle, and the ventricular systole, that is it is coinciding with the atrial diastole and it constitute around 0.3 second, whereas the remaining 0.8 second, that is a 0.5 seconds, it is by the ventricular diastole. This same thing is the one which you are supposed to draw in the initial portion, that is the topmost one. You can see here, this is the ventricular diastole, this is the ventricular systole, and this is again the ventricular diastole. This portion is the one which is drawn in the topmost portion of the Wiggers diagram, followed by our atrial cycle, that is atrial systole as well as the atrial diastole. And next is about the duration as well as division of each phases of this atrial as well as the ventricular cycles. And the next parameter to be drawn is the aortic pressure, first you have to draw the pressure changes here. So the three pressure changes you are supposed to draw. The topmost one, that is aortic pressure, represented by the green line. Next is about the left ventricular pressure, drawn in red color, and left atrial pressure. It is basically your JVP or jugular venous pulse, drawn in blue color. And next is the volume changes, and you have to mark the values from 50 to 180. And the ventricular volume changes, it is represented by the pink color. Below that, an ECG is shown corresponding to the different phases of the cardiac cycle. And the last one is the phonocardiogram, which includes the four heart sounds. Wherever these four heart sounds are appear, that you have to represent it in the different phases. So first you have to mark the pressure changes, that is extending from 0 to 120. Next is about the ventricular volume in ml, and next is the ECG as well as the cardiac sound. Again, here the different phases of the cardiac cycle, different subdivisions of each phase of the cardiac cycle is marked here. Now we are going to study in detail about the different phases in the cardiac cycle. First, we will study about the atrial cycle, which include atrial systole as well as the atrial diastole. So you can see here that the atrial systole, it lasts only for 0.1 second. This is the atrial systole portion in the Wiggers diagram. And you can also see that it coincides with the last rapid filling phase of the ventricular diastole. So this is where the ventricular diastole starts. Here, the atrial systole usually coincides with the ventricular diastolic portion. That is the last rapid filling phase of the ventricular diastole. And this contributes only about 30% of the ventricular filling, and more contribution with the rapid heart rate. And these atria usually acts as a booster pumps that increase the ventricular pumping effectiveness as much as 30%. And during the atrial systole, that is contraction of the atria is happen. So there may be some backflow of the blood into the vena cava as well as into the pulmonary veins, as there is no valves between the atria as well as the great veins. However, as the atrial muscle contracts, it usually compresses and nearly collapses almost all the venous entry points from the superior vena cava as well as the inferior vena cava, minimizing the backflow into these blood vessels. And during this phase, there is the pressure inside the atria rises, and this increased in the right atrial pressure, it is actually reflected in the internal jugular vein. And you can see here that is this left atrial pressure, that is there occurs the presence of a wave corresponding to the atrial systole. So because of the atrial pressure rise, and as it is reflecting into the right atrium, this contributes to the A wave in the JVP. And the ventricular pressure, what happens to the ventricular pressure as well as volume? The ventricular pressure as well as the volume, it is actually slightly increased. You can see here the ventricular pressure is only slightly increasing, as well as the ventricular volume is also slightly increasing during this phase. And correspondingly, you will get the fourth heart sound due to the inrush of the blood into the ventricles during the atrial contraction. Next phase is about the atrial diastole. So in the atrial cycle, you can see here that the rest is completely occupied by the atrial diastole, occupying around 0.7 seconds. And it coincides with the ventricular systole as well as most of the ventricular diastole. Now, what is even happening during atrial diastole? There occurs gradual filling of the atria because the atrial muscle is relaxing. So there occurs gradual filling of the atria by continuous venous return from the major vein supplying the atria. Next is about the ventricular systole. So we are moving on to the ventricular cycle. First, we will see about the ventricular systole. The duration is around 0.3 seconds, and we can further divide or subdivide the ventricular systole into isovolumetric contraction phase, which is lasting around 0.05 seconds, followed by a rapid ejection phase 0.1 second and a reduced ejection phase, that is 0.15 seconds. So this portion, this is the ventricular systole. So the first one, that is 0.05, that is isovolumetric contraction phase, followed by 0.1 second, that is a rapid ejection phase, followed by 0.15 second, that is reduced ejection phase. And here we have shown the pressure changes, then volume changes, then the ECG changes, as well as the heart sounds. So first about the isovolumetric contraction phase. This is also known as isovolumic or isometric ventricular contraction phase, and it lasts for about 0.05 seconds. And the onset of this one coincides with the upstroke of the R wave in ECG. So here the onset of this ventricular systole, you can see here it coincides with the upstroke of the R wave of the ECG. And here, during this phase, the semilunar valves are in a closed state. So, the intraventricular pressure is very, very low. That is nearly 1 to 3 millimeters of mercury. So, in this phase, the pressure, have to draw it as only very low pressure. That is 1 to 3 millimeters of mercury. Now, as the ventricular systole begins, that is the ventricular starts contracting, what happens? The intraventricular pressure will start increasing. So when the ventricular pressure it exceeds the atrial pressure, what happens? The AV valve will close firmly, which is responsible for the first heart sound. That is why, that is during atrial systole we will get the fourth heart sound, and during the first phase of the ventricular systole, that is during the isovolumetric contraction, you will get the first heart sound. Now both the AV valves as well as the semilunar valves are closed, and the ventricle is contracting as a closed chamber. So the volume of the blood in the ventricle does not change. Hence, it is also called as the isovolumic contraction phase. And during this phase, there is little or no shortening of the ventricular muscle fiber is happening. That is why it got the another name, that is isometric contraction phase. And during this phase, the intraventricular pressure, you can see here, during this phase, the intraventricular pressure rises steeply. And because of the increase in the pressure in the ventricle, the AV valves will budge back into the atria, causing a rise in the intra-atrial pressure also. So the intra-atrial pressure also is increased, and this bulging into the atria causing this intra-atrial pressure will reflect as the C wave in the JVP. And this phase will last until the left ventricular and the right ventricular pressure exceed the pressure in the aorta, that is 80 millimeters of mercury, and the pulmonary artery pressure, that is 10 millimeters of mercury. And the ejection phase will begin with the opening of the semilunar valves at the end of the isovolumetric contraction phase. Next is about the rapid ejection phase. So the next to the isovolumetric contraction, this one, that is a 0.1 second lasting phase, that is the rapid ejection phase. So as soon as the intraventricular pressure exceeds more than 80 millimeters of mercury in the left ventricle and 10 millimeters of mercury in the right ventricle, our semilunar valves will open. So what happens when the semilunar valve is open? All the blood will be ejected into the aorta as well as into the pulmonary artery. That is, two-thirds, almost 70% of the stroke volume is ejected during this phase. And because of this ejection, what happens? There occurs rapid reduction in the ventricular volume. So this is the phase we are studying, and you can see here there occurs a rapid reduction in the ventricular volume during the rapid ejection phase. And since the ventricles are contracting powerfully, what happens to the intraventricular pressure? It rises and reaches a peak value of 120 millimeters of mercury in the left ventricle and 25 millimeters of mercury in the right ventricle. So you can see here that as the ventricles are contracting, there occurs an increase in the intraventricular pressure. That is, the left ventricular pressure will reaches a maximum value of 120 millimeters of mercury. Simultaneously, what happens? The pressure in the aorta as well as the pulmonary artery will also rises because of the ejection of the blood into these vessels. So the AV valves will be pulled down by the contraction of the ventricular muscle, and there occurs an intraatrial pressure drops, which is represented as the X descent in the JVP. So the intraatrial pressure dropping that occurs in this rapid ejection phase, and it is actually represented as the X descent which is happening in the JVP, and this coincides with the ST segment of the ECG. Next phase, it is about the reduced ejection phase, which lasts around 0.15 seconds. During this phase, the rate of ejection actually decreases. That is, about 30% of the stroke volume is only ejected during this phase, and the intraventricular pressure will start declining. The aortic pressure also will decrease as the peripheral runoff is more than that of the inflow. So, though the intraventricular pressure falls slightly below that of the aortic or pulmonary pressure, momentum will keep the blood moving forward into these great vessels, and the ventricular volume continue to decrease but at a slower rate. And this phase actually coincide with the T wave of the ECG. So here the volume will further decreases, which is shown by a slight slope here, slight slope downward here, and again the pressure will also found to be decreases in the last phase, that is the during the reduced ejection phase. And few points which you have to remember from this area is that the amount of blood ejected by each ventricle per beat or stroke, it is known as the stroke volume, and the normal volume, it is around 70 to 90 ml. And the volume of the blood at the end of the diastole, it is usually end diastolic volume, and the normal value of the end diastolic volume is 130 ml. Volume of the blood that remains in each ventricle at the end of the systole, that is the end systolic volume, and the normal value is 50 ml. And another MCQ question or any short question which can be asked from this side is ejection fraction. What is this ejection fraction? It is the percentage of the end diastolic volume that is ejected with each stroke, and it is normal value of the ejection fraction is 65%. And this is also a valuable index of the ventricular function. So from this area, these MCQs or 1-mark questions can be asked. Next is about ventricular diastole. So we have finished with the ventricular systole. Now we are moving on to the ventricular diastole. Ventricular diastole, you can see here, 1 square is 0.1. So ventricular diastole lasts for about 0.5 seconds. And under ventricular diastole, we can classify it into these phases. That is, it is subdivided into protodiastole, which lasts for around 0.04 seconds, the first one. So this narrow area, that is a protodiastole, followed by isovolumetric relaxation for about 0.06 seconds. So in total, the protodiastole and isovolumetric relaxation will comes in this square. Then next, it is followed by the first rapid filling phase, which is around 0.1 second. So first rapid filling phase will be coming under this square. Then followed by a diastasis, which is around 0.2 second. That is, extending these two squares occurs the diastasis. And the last phase is the last rapid filling phase, where this one coincide with the last rapid filling phase, which coincide with our atrial systole. That is around 0.1 second. So about the first phase, that is protodiastole. Protodiastole lasts for about 0.04 seconds. So after the ventricular systole, the ventricles start relaxing and the intraventricular pressure decreases. So it is represented by a decrease in the pressure in the first phase, that is the protodiastolic pressure. And when this intraventricular pressure is less than the pressure in the aorta and pulmonary artery, what happens? There occurs a tendency for the blood to flow back from these vessels into the ventricles. But this flow is responsible for the closure of the semilunar valves, and thus the second heart sound occurs at the end of this phase. So the second heart sound you have to draw at the end of the protodiastole. Now what happens to the volume change? Not much change in the volume. Next is about isovolumetric relaxation phase, which is around 0.06 second, and this begins with the closure of the semilunar valves, that is represented by SLC here, and the AV valves are also still closed. So the ventricle is relaxing during the diastole as a closed chamber, and no change in the volume occurs, hence the name isovolumetric relaxation phase. You can see here that during this phase there occurs a sharp fall in the ventricular pressure. Atrial pressure is more, but the atrial pressure is actually more than that of the ventricular pressure. You can see here atrial pressure is drawn above the ventricular pressure. So the atrial pressure is more because of the continuous inflow of the blood into the atrium from our great veins, while the AV valves are in a closed state, and this one it is responsible for the V wave in the JVP. So V wave you have to draw in the isovolumetric relaxation phase. And when the ventricular pressure falls below the atrial pressure, what happens? The AV valves will open. So that is here it is representing the AV valve opening. Thus, the this isovolumetric relaxation phase, it extends from closure of the semilunar valve to the opening of the AV valves. So here the semilunar valve closure is shown in the initial phase of this phase, that is isovolumetric relaxation phase, and at the end of the waves this AV opening you have to show in the diagram. Next is about the first rapid filling phase, which is lasts for about 0.1 second, and it begins with the opening of this AV valves. Now what happens when the AV valves open? Blood will flow from the atria into the ventricle passively, and the atria, ventricles as well as the great veins will act as a symbol chamber. And you can see here that as the blood flows from the atria to the ventricle, what happens? The atrial pressure falls slightly, and this decrease in the right atrial pressure will give rise to the wide descent in the JVP, and large part of the ventricular filling takes place during this phase. That is why there occurs an increase in the ventricular volume in this phase. So the ventricular volume you have to draw it as it rises steeply during the first rapid filling phase, and due to the rapid flow of the blood from the atria into a ventricle, it results in the third heart sound in this phase, that is the first rapid filling phase. Next is about the diastasis or the reduced filling phase, that is the last portion, that is 0.2 second. It lasts for 0.2 second. Here during this phase the ventricular filling is slowed and the atrium is getting empty, because the filling of the ventricle is slowed because the ventricle is already well filled and the atrium is getting empty. So 70% of the ventricular filling occurs passively already during the early phase of the ventricular diastole, and with the increase in the heart rate, the diastolic period is shortened and the duration of this slow filling phase will be much reduced whenever the heart rate get increased. Next is about the last rapid filling phase. This one, that is, it lasts for around 0.1 second and it usually coincides with the atrial systole. So the same thing what you have drawn in the first column you have to draw here also. So it lasts for 0.1 second and it coincides with the atrial systole. That is, it coincides with the atrial systole, and this contributes for 30% of the ventricular filling. So this same thing you have to draw here, that is 30% of the ventricular filling. Again the right atrial pressure increases So here also the right atrial pressure increases and it contributes to the A wave in GVP. So the A wave which you have drawn in the GVP here, you have to draw in this last rapid filling phase also, and it corresponds to the fourth heart sound. So all the events which is happening in the atrial systole is same as that in the last rapid filling phase. So this is the most important diagram you are supposed to draw along with the cardiac cycle. First draw the atrial cycle, then ventricular cycle, then the duration, then about the aortic pressure changes, then about the left ventricular pressure changes, then this blue line about the left atrial pressure changes where you have to draw the JVP, then about the ventricular volume changes, and you have to also show the ECG, which all waves are coming in which all phases, and also which heart sound is coming in different phases. Thank you.